For my multiple intelligence project, I chose a malignant bone tumor called osteosarcoma. Osteosarcomas are the most common primary bone cancer. The tumor growth causes the periosteum to separate from cortical bone on the metastasis. Once the periosteum is lifted, spicules of new bone begin to form, and this causes the bone to have a sunray or sunburst appearance. The most common site for these growths is going to be in the long bones of the body, the most common being the humerus and the femur. Today, we will be imaging a femur because it is the most common site for these growths. So today we're doing our femur x-ray. Because the femur is a long bone, we will have to do it in 2 segments. So first we're going to do our AP, and we're going to do the upper first. So before we get the patient on the table, we usually ask them to change from the waist down, make sure that nothing is going to be in our image. So we have her on here. We're going to make sure we detab the tube. And we're going to line everything up. So normally we go to the mid shaft of the femur, but because we're going to be doing the upper portion, we're going to go a little bit more proximal to make sure we get the top of the femur. And then we collimate to the region of interest. And we make sure we put our marker on there. And we shield. And then very last, we're going to turn her foot in to make sure that the lesser trochanter is superimposed by the shaft of the femur and that the greater trochanter is in profile. And then we're going to measure. And she measures at 15. Next, we're going to move on to the distal femur. We're going to make sure that we get the knee, so we have both joints. And once again, we're going to collimate to the region of interest. And mark it. And measure again. And she's measuring out of 12. Next, we're going to move on to the lateral femur. We're going to start with the proximal side. So we're going to make sure that we have the top of the femur here, and we're going to center to the upper portion of the mid-shaft of the femur. And we're also going to turn the collimator so that the anatomy is up and down on our cassette. And then we're going to mark it. We're going to measure. She's measuring out of 12. For the distal femur, we're going to have her roll up onto her side so that we can make sure that the lower part of the femur is superimposed. We're going to make sure we shield. And you make sure that the shielding is not in the way of the anatomy. And we're going to measure again. And here she's measuring out about a 10. And that's it.